Seems fair to me.
Yes, he did.
Well, if you don't know what fair is, you can't make it.
Donnybrook is made possible by the members of the 9 Network.
Well, thank you so much, and welcome to this first day of spring and a special hour-long presentation of Donnybrook with your phone calls and tweets and an extra special guest who's going to join us this hour. We'll introduce him in a moment, but as you're about to see, we are actually practicing social distancing for this edition. That's right, no green table. I think we put it in quarantine, but I'll tell you what, we're going to talk about COVID-19 and the coronavirus pandemic, along with your phone calls, your tweets, and more. So let's meet those who are not assembled around the big green table for this edition, starting with the news director for the Big 550 KTRS, Wendy Wiese, along with one of our founders, Mr. Bill McClellan from the St. Louis Post-Dispatch, another founder, Ray Hartmann from the Ray Hartmann program weeknights at 9 o'clock on KTRS, as well as the Riverfront Times, and from the St. Louis American, 590 AM and 97.1 FM News Talk, The Dave Glover Show, Alvin, Reid. And before we begin our discussion tonight, first of all, thank you everybody for joining us. We do want to remind educators in our audience that KETC, the 9 Network, has a special education toolkit which is available for your perusal and the edification of your students, whether they're in the classroom or studying online right now. And please contact the 9 Network for that. Also, at 8 o'clock, Judy Woodruff and the team at the PBS NewsHour will have a special one-hour edition of their program, taking a look at the coronavirus pandemic and, of course, from a national perspective. Okay, so why don't we start then with you, Alvin? We're going to ask everybody to tell us how they're reacting to the pandemic, starting with the Reid family in the special city of Kirkwood.
Well, the Brennan family, I think, is going through some of the same things. Our daughters are home from college, and, you know, we're making do. And it's interesting because, you know, they're usually, when they're home, they're ripping and running and all that, but they're pretty much in the house. I had to print out some little signs that said class in session because twice now I've been either talking loud to one of the girls and the other one says, like, hey, studying in here, like online class, remember that? But I mean, you know, people are wearing gloves and people are wearing masks, but I'm telling people, keep wearing a smile because I think it's important to just keep a positive mental attitude, and we're trying to do that in the Reid household, and it gets a little tougher, you know, every day that goes by, but in the meantime, I mean, we're making do. And one thing I was on earlier today on with Dave Glover, and I said that, you know, remind younger people, and when I say younger, maybe like 40 years old, that what you hear at 8 or 9 o'clock now is what we heard when we were kids, and it's silence. There's not a lot of cars out, and there's not a lot of activity, and this whole world where we live in now, where everything goes to 1 and 2 o'clock in the morning every day, it wasn't like that. So I've heard this before, and we just got reminded of it.
Bill McClellan.
Well, I've become kind of a hermit. I mean, I used to go to Schnucks almost every day. I don't do that at all. I'm only here tonight because we're not clustered around the green table. I've changed my lifestyle to the point that I bought half a case of wine last night. And usually I'm a social person who likes to go to the wine store and buy a bottle at a time. You know, and as you guys know, I have a glass of wine each night, sometimes a large glass, sometimes a small glass. But I like to, you know, look at a bottle and look at the label and chat with people. And, you know, one bottle lasts me for a few days, a couple of days. And I decided I'm just going to stop all that. I went to Parker's table and said, outside, I said, you know, I want to buy half a case of wine, 6 bottles. And I didn't even go inside. You know, they said, what kind of wine do you want? I said, well, you guys know. So they said, okay, between the $10 and $15 range. And I said, no, let's special occasion. Let's go 10 to 20. But, you know, I said, so I didn't even go into the newspaper to write a column this week, and I always do that. You know, unfortunately, I still have to be out a little bit. You know, I have to be at Hartmann Cancer Center every other week for chemotherapy, and I'm a VA patient, and one of the notes that they sent was avoid sick people. And I thought, well, that's hard to do when you have to go to Hartmann Cancer Center every couple of weeks.
Right.
But as much as possible, I'm avoiding people, and it's very difficult because I am such a chatty person.
Well, so glad to have you as always.
What about you?
Well, I'll tell you, kind of like Alvin, the kids came home from college, and the chemistry of the home changes quite a bit, but we're glad to have them. You know, we were empty nesters. We're not anymore, so we're all staying inside, and the house seems a little smaller right now than it was. But I'll tell you what, it's if there's a silver lining, it's good to see the kids back. I'll put it that way. Other than that, we are hermits as well. Wendy?
Yeah. Both my husband and our oldest daughter, who lives in the Central West End, work for Mercy. So there is a great deal of discussion about the way the healthcare system in the city and the county, you know, the way it's being tackled. I am personally, as you said, Alvin, I think that it is really, really important to be as positive as you can possibly be. And I think that's what's really touched me the most is our neighbors, our friends and our neighbors here in St. Louis. People, by and large, I know that there can be the ones who let their anger maybe get out of control. But I think by and large, people have been heroic, truly heroic, trying to make everybody feel better instead of raising the level or moving the needle up in terms of stress. I think everybody's been downplaying it. I think personally also, I am very, very hyper aware of not falling. I think we all have to be very careful with our own safety and well-being because the healthcare system is preparing to be overburdened, and we all have to be careful not to add to that burden. So that and trying to find frozen green vegetables. That's my mission this week. And at the radio station, we are really, really vigilant about cleaning and disinfecting hard surfaces constantly. So we are down to really a skeleton on-air crew. But it's like everybody else. There's something very comforting about the fact that we're all in the same canoe.
And one of the skeletons?
There he is.
Well, I mean, this is Donnybrook, and I don't want to be too collegial. So, I mean, if we're asking everybody not to hoard toilet paper, I don't know about this hoarding wine. I mean, this is
that's not
concerning
right
me.
either.
I mean, with my fellow founder. No, our family is like everyone else, self-quarantining effectively, and my kids, Ben and Brielle, have a great attitude about it. And they're just, this is spring break, first of all, but it's they're just very good about it. And, you know, I basically get up. My dog is, wants to get out 2 or 3 times a day. We go out. But for the most part, I go to the radio station where we're doing everything remotely, and there's a lot of distance. I mean, there's just usually 2 people in the station when I'm there at 9 o'clock. And I think, seriously, to kind of echo Alvin's point, when we come out of this, I think the fact that we are working as a community with the help of institutions like Channel 9 to bend the curve together is something we ought to be thinking about. I mean, we live in this time of polarization, and the fact that we are hopefully all of us working together to bend the curve, when we get on the other side of this, we ought to take that with a sense of pride.
Amen.
And I'll be honest,
well said.
I have used more hand sanitizer in the last 2 weeks than in my life.
My hands are bleeding.
I
I
was
watched
gonna
it
say,
walk.
seriously.
I'm
So,
more
like,
concerned
yeah.
about...
Yeah, absolutely.
Yeah, I'm more concerned about the skin grafts that we're all going to need after our
What
skin
is
starts
it?
falling
That's
off.
right.
I don't
Hey,
care.
There's that.
Hold that thought, because we do want to introduce to our program tonight, for the first time ever, a special expert joining Donnybrook during the program. And we welcome Dr. Gregory Storch, who's a professor of medicine and molecular microbiology at the Washington University School of Medicine. He's also the Ruth L. Siteman Professor of Pediatrics. His specialty, infectious diseases. Dr. Greg Storch, thank you so much for joining us. May I ask you, how do you think we're doing here in St. Louis, and what recommendations would you have for our viewing audience?
Well, hi, Charlie. Glad to be with you all. I think the first thing is that we have benefited from being in the middle of the country, and the outbreak of COVID-19 is slower getting started here than in most other places. And that has given us some additional opportunity to prepare. And I think the people in the metropolitan area are doing a good job. I think the precautions that have been put into place about prohibiting or at least discouraging gatherings of more than 10 people, of closing restaurants and so forth, I think it's very unfortunate that that's what we need to do, but I think that is what we need to do. And so I think we're doing the right things.
Very well. We already have a question for you from our listening audience, and it comes from John in Wentzville. Hi, John. What's your question for Dr. Storch?
Well, it seems to me that this bug is out there already. It's going to stay out there until we either get an effective vaccine, which is going to take about a year, or I'm not sure about how this works in the public, but when enough people, are people going to develop immunity to this? If so, then a lot of people are going to have to get immunity before this bug dies down. What our current measures are just kind of flattening out the spikes. So it's gonna push it out. I don't know if the same number of people are going to get sick, but there's going to be a lot of people still getting sick, even if we flatten this thing out.
Okay, John.
Because we don't have any way to treat it or prevent it.
Okay,
in terms of vaccine, and the only natural way to do it is to have a lot of people get it so that...
Well, okay, now let me just hold off right there. John, thank you so much. John, I think you spoke clearly. What do you think, Dr. Storch?
Well, it's a complicated question. Let me tackle it in a few ways. One is that he is absolutely right, John, that we don't have a vaccine to prevent this disease, and we don't have any established treatments. So that's one of the reasons why this is such a serious situation, that we don't have the tools that we like to have to counter infectious diseases, the tools that have made things very different from how they were in this country 100 years ago. But we are in a situation now that's not too different from what we were like at the time of the Spanish flu in 1918, by not having a vaccine and not having treatment. So what we have to do is undertake behavioral changes as a society, and that mainly consists of social distancing. And I think the things we're doing are unprecedented. Who would have ever thought that we would see the professional sports teams suspending their seasons, Broadway shows stopping, and so forth. But I have to believe that those things will have some effect in slowing the spread of the virus. Now, there is just a few occasional threads of optimism here, and one is that we can look to some countries, including China, and see that they have had success in not only flattening the curve, but in China, apparently almost ending transmission of this infection through very strictly imposed behavioral changes. And so I do think that if we carry out these changes, we will change the rate of transmission of this infection. Now, that will not necessarily prevent people from becoming infected, but it will hopefully slow things down. And the importance of that is that hopefully will prevent our healthcare system from becoming overrun. You know, what's gone on in Italy and a few other places is that their healthcare systems have been presented with so many severely ill patients at the same time that they can't cope, and they can't provide the level of care that they would otherwise be capable of preventing. So I think it's very important to do everything we can to slow down the transmission of this disease.
Okay.
And then we don't know what the future holds. We'll have to see.
Right. And following up on that, thank you, Dr. Storch. Let's get back to our panel here. Ray Hartmann, the governor of Missouri, Mike Parson, has not closed the restaurants and the schools, unlike Governor J.B. Pritzker in Illinois. How do you feel about that? Now, as we know, certain counties have ended dining in restaurants as well as closed schools, and some school districts, of course, have. But it looks as though the approach by Parson is quite different from Pritzker. What do you make of that?
I would say I'm puzzled and disgusted at the same time. we just got saying, we want to not politicize this. We'd like to make it, bipartisan and pull the curve together, bend the curve together. Not only Governor Pritzker, but Governor Pritzker and 37 other governors. So there's 38 states that have closed the schools. And they just had a session in which the Republican legislature, and again, that's what it is, basically refused to give appropriation authority to Mike Parson, who's a governor, for emergency stuff. Their own guy. They didn't give him appropriation thing. This isn't partisan when I say it. They basically gave $40 million, $33 million of it, which was federal flow-through money. So effectively, when they went down there saying they were going to do this budget thing, they basically said nothing to see here. And so it's really remarkably sad.
Well, Ray, I think that I think the governor should have closed the schools. But I'm neither puzzled nor disgusted that he didn't. It's a little bit of political calculus, I think, that, most of his base in rural red Missouri still thinks this might be a media hype. And secondly, it's easy to be behind the curve on this thing. I've been behind the curve. Just last week, my daughter and granddaughter were downtown, and I said, hey, let's go to lunch at Charlie Gito's. And that was just a week ago. And I think, well, I shouldn't have done that. But so the fact that the governor's behind the curve, understandable. People are confused.
My thought on it is that one of the things he said is he wants to leave this up to the local school districts. Well, the majority of local school districts did not want to start school until like Labor Day. And the legislature takes all kind of, liberties with local school districts and tells them what to do.
Right.
So you can't lean on that defense, okay? So if you're not really letting local school districts do what they want to do, all right,
well,
then you're being hypocritical. This is a little political.
But conversely, our friend Ray, and maybe most of us, are always in favor of local control, right? And this is one case where the governor is giving us local control, and we don't like it.
Well, the governor, in an interview today from Jefferson City, a press conference, he basically sided with small business, and he said as much. He said it's much easier. He said it's much easier said than done to close down businesses, because he said, I have been a small business person and I know what it's like to face making payroll. And what leaves me completely mystified about that, as mystified as I am about the hundreds of thousands of people who are on the beaches in Florida who will fly back through all of their metropolitan airports around the country, bringing heaven knows what with them. This is a public health emergency, and you're not going to have any customers, Mr. Small Business Person. And I think that this is the time for leadership.
Well, let me
solid leadership.
Well, let me bring in Bill, because you're a native of Illinois, and the governor there, J.B. Pritzker, did not postpone the elections last Tuesday. We had, of course, the Illinois primary. Joe Biden beat Bernie. Well, a lot of seniors, I bet, didn't want to work the polls. A lot of seniors probably didn't want to vote. And Mike DeWine, the governor of Ohio, said, hey, we're not going to have a Ohio primary during the middle of this pandemic. Do you think Pritzker did the right thing?
No, I think that was a terrible decision. I think that he should have closed the elections. That's a state thing. It's a public thing. It's just astounding to me that he wouldn't, and had to call for volunteers to go work the polls. I mean, that's just terrible judgment on the governor of Illinois' part.
And this was after very heavy-handed remarks about the bars and restaurants Pritzker made in the days, maybe 72 hours leading up to the primary. Very heavy-handed, and then don't forget to vote. There's a real mishmash, hodgepodge in terms of leadership right now.
Logistics should not matter, but it does. Illinois is a big state. And to maybe throw a wrench in that mechanism of having the primary, just rather than restart, because you don't know when you're going to restart again, this is this is the last thing, but we are going to vote. I would stand behind him on that, only because we could get it out of the way And that's that.
Oh,
Okay,
Alvin.
Well,
now I just got word that the governor tonight in Missouri did close the schools statewide at 5:30 p.m.
No, he did it just after.
Okay,
right,
just
we
behind the
said.
curve. That's what I
No,
said.
I think he heard us.
Good decision.
Why did you have to say it was 5:30? You could have said
10 minutes
Hartmann
ago.
got done talking, and
the governor's
watching from someplace.
flipped
and
the switch.
We could have
Right.
taken some credit for this. Now, I will say this, that I actually don't know. I guess it's too late to decide on Illinois. I'm kind of like, it's amazing. In coronavirus years, that was like 4 years ago, you know.
Yeah.
I mean, this thing's moving so fast. I do think, to Bill's point, though, that Governor Pritzker has been sending some mixed messages, and that's, I think, frustrating on both sides of the river to residents when they hear one thing is okay and another thing isn't, and they see, you know, some places where you can, you can congregate. I'll tell you who, not to plug my show, but who's done a very good job, I think, is Metro. We don't talk about it much, but Metro has got all the trains running. They're scrubbing everything down, the cars, the Metrolink cars, and shout out to Talby Roach. He's, I think, done the right thing.
You know, I'll
he sent
tell
his
you what.
son up to Chicago to pick up gloves when the drivers came to him and said, we want gloves. He literally got his son up and sent him, his college son, his home. And that was a great story. And,
Make yourself
and I
useful,
think
son.
Talby Roach deserves some credit.
You know,
because
I love
we
mass-
always jump him when we're unhappy with stuff.
I love mass transportation, but I think there's never been a better time to be the driver of an automobile and to be driving alone. Now, let's get a few calls in, then we'll get to see what Dr. Greg Storch has to say. Let's go to Reggie in Melville. Hi, Reggie. Thanks for joining Donnybrook. Reggie? Reggie may not be there anymore. So let's see if John in Fenton is available. Hi, John.
Might want to tell them to listen to their phones instead of their television
Will
sets.
in Chesterfield. Okay, Will, take it away. Hold that thought. Let's go to Greg Storch. And Doctor, you're an expert on infectious diseases. How do you feel about some schools not being closed, not all restaurants closed?
Daycare centers?
Daycare centers. Actually, it's a little bit of a hodgepodge because they're saying no funerals with more than 10 people. My goodness, that wouldn't include some people's, immediate family. And then you also have daycare centers are open, as I said. What do you think about the social distancing and the public policy, Doctor?
Well, I do think that it's important to move ahead of the curve and try to carry out as much social distancing as possible. And things that bring together groups of people potentially serve as amplification points for this outbreak. In other words, a person who's infected and contagious comes into a situation where there are 40 or 50 people gathered around and may infect a number of them at the same time. And events like that can really accelerate the outbreak. So the more that we can prevent those kinds of gatherings, the better off we're going to be from the standpoint of the spread of this virus.
And yet we understand from some research in the Lancet, the English Medical Journal, and elsewhere that students don't seem to be getting this coronavirus, at least in great numbers. Is that correct?
Did you say students?
Students, yeah, the young.
Yeah.
People
Well, let me
between
say
0
a
and
couple
9
of
years
things
old?
about that.
Go ahead.
It's definitely true that age is a very important factor in determining how severe this infection is. And there's no doubt that it's more severe in general in people over the age of 60, and the fatality rate is higher in that age group. Most cases in children or teenagers are very mild. Young adults also generally mild. But they have to keep in mind that there are occasionally some cases that are quite severe, so they can't assume that if they get it, it's going to be mild. And they also have to keep in mind that if they become infected, they may be capable of transmitting the virus to other people for several weeks. And they may come in contact with family members or others who are older or who have compromising medical conditions for whom the infection could be very, very dangerous. So I think it's unfortunate if young people are cavalier about this and don't take appropriate precautions.
Ray Hartmann.
I would really like to see, and I'll show my age by not knowing who specifically to suggest for this. I'd like to see some PSAs and some messaging by folks that the Generation Z or whatever is listening to.
It's
'Cause
happening.
Is
it is happening.
Because I think this is important. One of the things I've heard, you know, going by my title, OK Boomer, is people my age, you know, crying out about the kids on the beach and saying, please, you don't understand, even if you are not going to die from this, you still can carry the disease, and think about what you're doing to grandpa and grandma, you know. And that messaging coming from my generation is not, I think, what we need to hear. We need it to be more organic from Generation Z. And maybe, and I admit I may not know.
Kylie Jenner and people like Kylie Jenner. Is it Kevin Durant? Is there
Kevin
a Kevin
Durant.
Durant? Kevin Durant. They are going wall to wall on Instagram. I think
That's
we've
good.
chased all of the millennials off of Facebook and some Twitter, but now they're all on Instagram and Snapchat and other platforms. But they are being told that message is getting out.
And you know, Bill, the behind the curve, I just want to go back there real quick. I get that, but okay, no excuse, because every professional sports league, every collegiate game at every level, 49 states out of 50 called it all off, and Missouri was still planning to have their high school basketball state tournament.
Right.
this coming
The
week.
last
Well,
one.
that's
That kind of stuff is just
that's Missouri, though.
Yeah, I know.
We're 48th, 49th all the time.
Well, maybe we can do better.
puzzled
Let's
to
go to the
discuss it.
phones. Bob in Bridgeton's been waiting to join us. Bob, take it away.
Good evening. Yes, I noticed you people have separated yourselves.
Right.
Yeah.
My comment is here in Bridgeton, we have several clothing stores, shopping strip malls, and they were flooded with children today, young people. They're climbing all over each other. They're trying on clothes. They're touching everything. And what's unique is they come down the Rock Road. These are the only stores from Bridgeton that you can, clothing stores, to the city of St. Louis. There's nothing else. It's a very unique situation. Okay? I think they should lock the students in the schools. I think they should meet them at the door with a mask, spray them down, separate them like you people are, and then teach them how to handle this virus. We don't need them running around all over town.
That's an interesting point. Thanks a lot. And it does turn out that in the county and the city has banned public gatherings greater than 10, except in workplaces and, of course, doctors' offices, and for some reason, in stores that are not attached to malls. At least that's the rule in the county. The county has, I think, prohibited groups greater than 9. But so I guess like the stores in Bridgeton would be exempt from the ban on large gatherings, which is kind of surprising to me.
And I think we need to be more consistent. This isn't like some kind of game. I mean, these are public health experts all over the very brightest. I hate to disagree with my fellow founder on this, because while it may be good column fodder that we're behind, I'm a little tired of it, to be honest. I mean, for example, one of the things other states are doing, I just heard, I think it was the Republican governor of Ohio, has required that elective surgeries not be going forward.
Right.
That to me is a very common sense thing.
But that's
because
just
we're worried
happened
about
within the last
no,
hour.
I get it. No,
in
it was
St.
a couple days. What? I'm sorry.
Well, I mean, it's been a couple of days,
Right.
but we just were receiving bulletins on our phone before we went to air that all of these elective surgeries have been postponed.
Across the country now?
No, across St. Louis.
Oh, across St. Louis?
Yeah.
But I mean, again, it's a type thing where if the governor, and he's a Republican of Ohio, can think of this, why aren't we on anything thinking ahead? And maybe to your point, it's political messaging, but
Well,
this
you know,
really
could
shouldn't be.
I agree with you.
I just
but
think we should be ahead.
You know,
situation's
and I don't mean to be defending this, Ray. You know,
I
I remember seeing a T-shirt a few years ago, long before all this started, and it said, "In the beginning of every horror movie, a scientist is ignored." and I've thought about that lately, and you know, and maybe the younger generation would be more attuned to a T-shirt, Wendy. Than
That's a great
maybe
line.
we should give them out.
Social messaging, yeah.
That's a great line.
Okay, let's ask Dr. Greg Storch then. Maybe you could weigh in, because as it turns out in the county, you can't have large gatherings unless they're in certain places like a store that's not attached to a mall. Does that make sense while you're telling people they can't have more than 10 people at a funeral? How do you stand on this, Doctor?
Well, I think the virus doesn't recognize those distinctions. And I'm surprised to hear that exception about stores, because certainly those people who are close together in a store, if the store is crowded, there is going to be risk of transmission of the virus.
Let's go to Afim in Chesterfield. Hi, Afim.
Hello, this is Asim Ahmed. I'm also a pediatric infectious disease trained physician. I can tell you I'm quite worried. The whole point of this social distancing is so that all the infections don't happen at once, such that you don't overwhelm the healthcare system. And you have to act before it seems obvious. When it's obvious to act, it's way too late. And the fact that Missouri is one out of just a handful of states that hasn't instituted statewide measures is quite concerning. Yes, Dr. Storch, we've been given a head start, but frankly, we're wasting that head start that we've been given. It's as if when China had cases, the U.S. saw it, they were given a head start, and then they also wasted that time. Every day that goes by is costing lives to the state of Missouri. And for the 20-year-olds and the 30-year-olds, when the healthcare system is overwhelmed, you won't be able to go into the hospital to get the care for the things that you don't expect, like a car accident or a heart attack or a diabetic issue, because the healthcare system will be completely overwhelmed.
Well,
we have had to act yesterday, and we're just sitting here idly by.
Thank you, Doctor. Wendy?
And Dr. Storch, if I am not mistaken, yesterday at the White House briefing, the point was made quite emphatically that millennials really are, they are not immune from this, and that they are seeing from Italy, they are seeing cases coming up where millennials are being very hard hit by this. So I think that we have to get a very consistent message out at the federal level to let them know that they are not immune, when really for the past 6 or 7 weeks we've been telling them that they are immune. Is that your understanding as well in terms of the threat to millennials?
Yes, I think you're referring to a study that came out in the last day that showed that 38% of severe cases of ICU cases are in the 40 to 65 year age group. And I think that caught a lot of people's attention. We do have to get the message out that even though in young people the majority of cases are not terribly severe, there are some that are. And it behooves them to be very careful and to take precautions not to acquire this dangerous virus.
Let's go to John in Fenton. Hi, John. What's your comment or question?
Yes, my question regards a news article that was on the news this evening about the ability to know who, in fact, in your area tested positive. Now, I know there's a medical problem with, you're not allowed to identify a person's condition. But under this circumstance, it seems it would be a very good idea to know, personally everyone, to know who has been tested positive so that we, one, could help them, and two, that we would be able to identify whether we in their company.
That's a good point. Bill, we're balancing privacy as well as public health, right?
Well, I think that people are just too irrational, John, to give out the names of people who are infected. I mean, I wouldn't want the responsibility. I was unhappy with the fellow who took his daughter to the daughter-father dance, but to make his name public, there'd be crowds on his lawn. I mean, you don't know what anybody would do. People are not rational right now, and that's been true for a while, even before this coronavirus. So I would definitely be against putting out the names.
I'm with Bill too. I think this is, talk about HIPAA and privacy. This is medical, and I really can't see any scenario under which there's any benefit. Obviously, someone who does test positive needs to be quarantined. You mentioned that person. Fortunately, he turned out to be negative, but I think that absolutely that Bill's right that you can't even go there.
Well,
I'm sorry.
and the cases are increasing, not exponentially, but we are already seeing a dramatic increase in these cases. And so it would, I mean, I agree with both of you, but I mean, just from a practical standpoint, that's just not possible.
Yeah, we just don't have enough pitchforks anymore.
That's right.
We need to-
That's exactly right.
Well,
Speaking of supply,
I don't know. Do you think there's a public safety angle to this, Dr. Storch? And by the way, do any countries out the individuals who test positive, or does every country seem to assure privacy to those who are afflicted?
Yeah, well, this is an interesting question. And of course, countries have different standards, different cultures. In Singapore or in Taiwan, they actually do make available to people the location of positive cases, with the idea that then other people can avoid going to those areas. They don't identify individuals. You know, these public policy decisions are difficult because they have ramifications, both positive and negative. If we went the direction of actually identifying cases, which I don't think is under discussion at all, but if we did, one of the very serious adverse consequences is that people would not get tested. They would be afraid of getting tested. And that would have a very bad public health effect, because we need to know who's infected so that proper quarantining can take place so that people can get the medical care they need.
Dr. Storch, would there be a benefit in certain parts of the country? We've seen these shelter-in-place policies. I mean, that is obviously very dramatic. But would there be a benefit to having a sort of a rolling 2-week type quarantine to break the chain, or to give hospitals a chance to stay on top of the newly diagnosed? Would there be any advantage there?
Well, I think that's an interesting idea, and I think we have to make reassessments on a day-by-day basis. And if we take a set of measures and we continue to see spread, then I think we have to tighten up on those measures.
Now, one measure, Wendy, is to release inmates who are at the St. Louis workhouse or in the county jail. The county prosecutor, Wesley Bell, the city circuit attorney, Kim Gardner, have both suggested that those who are awaiting trial and who, of course, haven't been convicted and aren't in jail for a serious violent allegation, that they should be released, because the jails will just be, I guess, incubators of contagion, and that these individuals who are still, presumed innocent, could be contracting this disease through maybe no fault of their own. What do you think about this?
Well, I know that that's also a question at the state level for Governor Parson, getting back to the states. The ACLU is trying to convince the governor to think about that. As long as somebody is not a violent offender, and as long as they are monitored in some way, I'm fine with that. If they're violent, if they pose a danger or a threat to society in any way, I'm very, very sorry. You can practice social distancing in prison, perhaps if you decrease the population by letting the workhouses, by letting some of the lesser criminals, if you will, go free.
Case by case basis, I guess, but it just, remember an issue where you said, like, why am I just not all on board with this? And for some reason, I'm just not. And I don't want to make it sound like you shouldn't be in prison or you shouldn't be in jail.
You mean with letting them go, or?
The letting them go,
Yeah.
okay? We're all in this kind of together, and we're all trying to pull through together. Let's pull us all through, and, the incarcerated, let's figure out, maybe after we're a little bit farther down the road.
Alvin, couldn't we just, on a case-by-case basis, like Wendy says, let the nonviolent offenders go, And if they offend again, then of course you throw them back in. But I think this is a time to be thinking about our common humanity and give people a bit of a break.
I'm all in, and I'll tell you why. First of all, both Wesley Bell and Kim Gardner are talking about a case-by-case basis. They're not saying like mass release. They have both specified very clearly that it's nonviolent people who are specifically not deemed to be a threat to society. And we already, I mean, it shouldn't take COVID-19 to get us to this, but we already warehouse too many people who haven't been convicted of anything because they're poor and can't find bail. And so I think absolutely.
Well, that's a whole other argument.
No, but I'm saying, I get it, but I'm saying we're
thing,
already
Ray,
doing it, and I think it's important.
When this issue is brought up with Judge Jimmy Edwards, who's the public safety director now and has quite a bit of experience in this area, he brings out the sheet of all those who are, you know, in the workhouse. And I looked at it most recently, and there was one guy in there who was in there for driving without a chauffeur's license. I would let him out. But by and large, everyone else on the sheet was there for a real serious violent offense.
Then they shouldn't be let out.
And so I don't know how many people would be let out. Dr. Storch, what do you think about this? Should the incarcerated be let out if they're in jail for nonviolent offenses?
Well, I'm going to give you the infectious disease perspective on this, and that is that incarceration facilities are tailor-made for spread of infectious diseases. And by having large numbers of people close together, we risk a really catastrophic situation. And it could then spill out. It could involve workers in the prisons. It could spill out into the surrounding communities. So I think it behooves us to try to avoid that kind of situation. Now, these are very complicated public policy decisions, but to me, just as a citizen, I think it is reasonable to look carefully at the roles and try to selectively move out people who are deemed not to pose a threat to society.
Dr. Storch, could I ask you a question in terms of clarification of medical terms? Coronavirus and COVID-19 are two completely different issues, are they not? And are we doing a disservice to one, coronavirus, by not making that distinction? COVID-19 is the threat, correct? Could you define and distinguish between coronavirus and whether or not coronavirus is the vehicle through which we are exposed and perhaps come down with COVID-19?
Yeah, so this comes from terminology developed by the World Health Organization. COVID-19 is the name of the disease. The virus that causes that disease is called SARS-CoV-2. But a lot of people find that very awkward, and so some people just refer to it as the COVID-19 virus. But they are intimately related. We're talking about the virus and the disease that it causes.
Thanks. We have a tweet from one of our viewers. Let's get to that. And we'll remind everybody that PBS has a special hour-long look at coronavirus and COVID-19, headed up by Judy Woodruff of the NewsHour, and that starts at 8 o'clock, so don't miss that. Annie Marie Berry writes, I'm feeling confused as to why coronavirus is a bigger deal than seasonal flu. I think that question is for Dr. Storch. Doctor?
There's been a lot of discussion of that question, and certainly seasonal influenza is a serious public health problem. We know that it results in 30 to 40 or more thousand excess deaths every winter. But we've become accustomed to that. We have measures that we can undertake, including a vaccine and treatment. And also, it's becoming apparent that COVID-19 is quite a bit more severe than seasonal influenza. It's really more comparable to the Spanish flu catastrophic pandemic of 1918. The fatality rate across the board for COVID-19 is probably somewhere in the ballpark of 1% to 2%, and that's 10 to 20 times higher than the fatality rate for seasonal influenza.
Our next call comes from Rick in Grover. Hi, Rick.
Hi, Charlie, thank you very much for this wonderful service, and Dr. Storch, thank you. So my first question was just answered. The second one, Charlie, is So is this the new? Are we going to see COVID again next year? What about next year?
Doctor?
That's a great question, and the medical community, the scientific community is debating that question, but the answer is we do not know. Viruses, especially new viruses, are hard to predict. A close relative of the COVID-19 virus was the SARS virus that caused the disease SARS in 2003. By 2004, that virus had completely disappeared. Several years ago, we had a very big problem with Zika virus. 1 year later, Zika virus unaccountably became very difficult to find. So it's just very, very difficult to predict the behavior of these viruses. It's possible that it may go away on its own, but unfortunately, it's also possible that it will go away temporarily and then come back next season. We just don't know that. But hopefully by the next season, we will have had time to develop some of the tools that we're very good at developing, including treatments and vaccines.
Ray?
I have a question for Dr. Storch, because just piggybacking on what you just said, are some of the things we're doing in terms of social distancing, so for example, not shaking hands, are they something, given that this could be happening again, that are going to be permanent? And because I say that, there are, for example, industries such as the cruise lines that may have a very difficult future in this way, and they may be candle makers unhappy with electricity. No, I mean in terms of industries. So is this something we need to be thinking? Some of these are more long-term solutions than hopefully this very short-term situation, what we hope is a
Yes,
short-term
it's an interesting thought. And, you know, we may learn new practices from our experience combating COVID-19 that will carry over to the post-COVID-19 era.
All right, Doctor. Let me have a question for you, Ray, because some of us are actually over 60. I know I am.
Hey, you're looking at me.
Well, the shoe fits. Some grocery stores have, with the best of intentions, set aside an early hour in the morning so that the seniors like you and I can shop. But as it turns out, the stores get overrun with seniors, and they're really crowded. It's like 10 o'clock on a Saturday morning. And so I'm wondering, are you taking advantage of these special hours?
I refuse as a matter of principle, even though, you know, and in fairness, I only have childhood memories of the Spanish flu. But one of my old dear Martin jokes, to myself. As a matter of principle, I feel too young.
You won't do it.
But I certainly am not going to question the grocery store's good intentions. People have to make their own decisions about this, really. I mean, I think it's the best of intentions. You know,
right. What do you say, Bill?
Well, my wife is doing the shopping these days, and so she's younger than I am. You know, if it were up to me, I'd say 70 and over should get a break, not 60 and over.
That's right.
But that would not include my wife.
Well,
so.
It might get to that. What do you think, Dr. Storch? Should there be an hour for those over 60? And what happens if it becomes too popular?
Right. If it becomes too popular, then it will no longer be effective. If the stores are crowded, regardless of the age group of the people who are there, there's going to be a risk of transmission. I want to encourage people to use online shopping alternatives and delivery, and I want to encourage the stores to very actively get on board with that, because that is a way of achieving or maintaining social distancing and preventing people from having to go into crowded shopping situations.
Alvin, you keep an eye on retail. What do you make of people hoarding?
Well, first of all, on March 6th, I became 59 and a half officially. And going with that 60 to over, listen, if you're me, and we've been blessed with good health, we don't have any reason to be down there between 6 and 7 o'clock in the morning, okay? Now, if you're infirmed or you're older, that's one thing. But I think it's crowded because a bunch of people like me that are trying to get toilet paper before it's off the shelf and doesn't have anything to do with protecting the health of anybody. The hoarding, I mean, I don't know what to say, okay? I don't know anybody that's got, 75 rolls of toilet paper. I got some more eggs today. I got 18. I could have got 36. I just figured, why, Alvin? So, I mean, to each his own. But to hoard things, I put it this way. if you're in your own mind, if you're being greedy, that's one thing. But if you're afraid, how can I tell somebody who's afraid what they should do? And
well, let's get to the calls again. Gary's in Benton Park, and I know you've got a question or a comment. Gary, thanks for calling.
Thanks. My question is, in the early infectious stages, the cases can be traced to individuals bringing it to the community. The incident of the father-daughter dance comes to mind. But at some point, it's no longer traceable. It crosses a threshold into community spread. I was wondering if the doctor has any comment on what testing is telling about whether we've crossed that threshold to community spread, and I'd like to hear his comments.
Dr. Storch?
Well, we haven't talked about testing, and I think it's important. The test is done on a nasal swab, and it detects the virus. And it becomes positive 1 or 2 days before the person develops symptoms. Now, it's important to recognize that the incubation period of this infection is anywhere between 2 and 14 days. So there is a period during the incubation period when the test will be negative. So a negative result from the test doesn't mean that a person is not infected and doesn't tell you that the person is not going to go on and develop the infection over the next few days. So that's an important limitation about testing. On the other hand, the testing can be very valuable in confirming the diagnosis in people who have symptoms. And I think as we go a little farther into this outbreak, testing will become very important to determine when people who are recovering are no longer contagious and can go back to work and go back to social interactions.
Dr. Storch, the first fatality in the state of Missouri was a Boone County resident who had apparently some international travel. In his recent past, he died the day after he was diagnosed, the day after his case was confirmed. Can you explain how that happens? Was this somebody who was just terribly, terribly sick and just didn't realize it?
I don't have any details about that case. I will say that is a very unusual circumstance for this infection. The more common course of this disease is for a person to begin having symptoms of fever, coughing, possibly shortness of breath, with a gradual worsening of those symptoms over about a week, and then a significant worsening in the severe cases in the second week, or if the person's going to recovery in the second week. So it typically is a more gradual onset than occurred in that case.
Mike, you're in Godfrey, Illinois. Welcome, Mike. Okay, maybe did I go to the wrong caller? Maybe it's William. Hi, William. Are you with us in Chesterfield? Or Mike in Godfrey?
Yeah, this is Mike in Godfrey.
Thanks, Mike. Sorry about that.
That's all right. The question and a comment, if this disease is diagnosed or a person is tested and they're positive, why aren't we trying to put a stop to it? Because of the interviews with this person and where they've been during the incubation period, say 2, 3, 4, 5 days before that, why can't we, and still abiding by the HIPAA laws, why can't we at least say that between 5 and 6 o'clock on such and such a date, this person was in such and such store or whatever, and then these people who are listening to this can then decide, well, we were in that store at that time, so then they can self-quarantine. Yeah. Because otherwise it's just like the domino effect.
Well, you
get it?
Yeah, they're doing that in Israel to some extent, Doctor, with GPS technology, aren't they?
Well, I think the caller makes a good point. I do want to mention that the health departments are really making every effort to do contact tracing. When there's a positive case, they are trying to interview that case and find out where that person was and who might have been exposed in the period when the person was contagious. How they notify those contacts has to depend on what the nature of the exposure is. If it were individual people, then they can notify those individuals that they may have been exposed and should go into self-quarantine. If the person attended a large event, then they might need to make the kind of public announcement that the caller is talking about. I think this needs to be decided very carefully on a case-by-case basis by public health professionals.
Doctor, we only have about 30, 40 seconds to go. Can you tell our viewers what they should be doing right now and who should get tested?
Social distancing is the key. This disease comes from other people, so the more, this is very unfortunate advice to have to give, but the more we can keep away from other people during this period of transmission, the safer we will be. Testing at this point is mainly reserved for people who have symptoms to find out if their illness is really COVID-19 or maybe some other viral respiratory infection.
Thank you very much, Dr. Storch. We sure appreciate it. And everybody, you can always comment on tonight's show by sending us a letter, and you can do that. Send it to 3655 Olive Street, St. Louis, Missouri, 63108. Or send us an email, letters@ketc.org. Don't forget those tweets, hashtag Donnybrook STL. Plus, of course, you can listen to this program again on your favorite podcast source, whether that be Apple, Spotify, Google Play, or TuneIn. We want to remind everybody, especially you school administrators and teachers, that here at the 9 Network, we have a special educational toolkit taking a look at COVID-19, and it's yours. Please contact the 9 Network. Also, stay tuned because Judy Woodruff and the outstanding team at the News Hour on PBS will have a 1-hour look at coronavirus from a national perspective. Don't miss this one. Thank you so much to our special guest, Dr. Gregory Storch from the Washington University School of Medicine, who made history tonight by being a special guest on Donnybrook. Another evening where, for the first time, we weren't seated around the big green table, but different times call for different measures. Thank you, Doctor, and thank you, everybody, for joining us for this edition. We'll see you next week.
Donnybrook is made possible by the members of the 9 Network.